Hey guys, Joe here. I wanted to do a quick walkthrough of the med bag for anybody who is interested in knowing where things are, which should be everybody. So here we go, do a quick walkthrough. So up here on the top zipper pocket, we've got a couple of things. The main one in here is gonna be Gonzalez inhaler. So we got that in the top for Gonzalo if he goes down with any kind of respiratory emergency during a run or whatever it may be. We've also got some surgical masks and some burn gel. That's it for the top zipper. Okay, next we'll check out the main pocket, which is this big one on the front. It's got two zippers. So we open up the main pocket. Right here we got a big old bag of gloves in case we need to deal with any body substance isolation, anything like that. Gloves. We got the defibrillator right here. It does work. The pads are expired. I mentioned that in the medical bag inventory. Haven't heard anything back yet from staff, so we're just rolling with what we got for now. But defibrillator, if anybody has any questions on how to use it, just let me know or let one of the other EMTs know who works in the field, and they should be able to show you how this thing works. We've also got a cylinder of oxygen. It's only half full right now. We've made staff aware of that as well. And again, we're just waiting to see what they want to do about that. But there is oxygen in there should we have an emergency. Here we got a clipboard, paperwork in here, medical assessments, trauma assessments, blank paper for taking notes. And then alongside the oxygen, we have our airway bag. So should we have any kind of respiratory emergency, this would be your first place to go. Up here, we've got cannulas and a non-rebreather mask. Again, I've mentioned in the inventory, we do need more of this stuff. So we're just waiting back to hear from the instructors about how they want to go about restocking this thing. And then over here on this side, I think we've got some OPAs of various sizes. So we got the OPA kit in there. For anybody who doesn't know, if you're sizing one of these to a person, you measure it from the corner of the patient's mouth to their earlobe, and that should be that distance there, the corner of the mouth to the earlobe. Most of us will probably be, one of these larger adult sizes, but, if you ever have a pediatric patient, it'll be one of these smaller ones. Again, the corner of the mouth up to the earlobe. Okay, we've also got an emergency blanket in here. If someone goes into shock or becomes hypothermic, we can cover them up with this. And we've got a couple more zipper pouches up here. These are primarily filled with gauze and bandages of various types and sizes. So we've got the abdominal pads, so 5x9 inch. And we've got 4x4 gauze. We've got sterile bandage rolls if you got to wrap up a wound. Again, some other size gauze sponges in there. We've also got 2 tourniquets, 1, 2. And then up in this next one is more bandaging supplies. So we've got triangle bandages. So if you had to tie up a sling for somebody for a broken arm, that's what we would use for that, is a triangle bandage. And then we've got another roll of gauze in here as well. Okay, then moving on to these side zippers. This is the triage pocket. So in here we've got, there's a Pelican case for the cell phones. We've got some baby wipes. And then in the zipper right here, we've got triage tape. So in case we had to triage patients, you know, somebody with black tape means they're dead. Red tape means they're critically injured. Yellow tape means moderately injured. And green tape means they're pretty much fine. And then back here, the triage tags. So if we ever had to triage an incident, which isn't going to happen with us, that's what we would use to tag the patients and determine their priority. All right, and then the last pocket is going to be the vitals pocket. This one we might actually use if someone were to have some kind of a medical emergency and we're waiting for EMS to show up and transport them. Instead of just hanging out there, we could get them going on oxygen or whatever, and then we could also get a baseline set of vitals for EMS when they showed up. So we've got a temperature gun, works real well. Practice that one at hazmat. We've got the pulse ox. We've got a glucometer kit. We've got our BP cuff, just the one size, regular adult. And then in this zipper here, we've got our stethoscope and 2 sets of trauma shears in case we need to cut off any clothing or cut bandages, anything of that nature. And that's just about the whole bag. So just to recap it real quick, in the brain, we've got the masks, the burn gel, and Gonzalez inhaler. In the main pocket, we've got some O2, along with the airway bag, cannulas, and non-rebreather, defibrillator, a paperwork binder. Then up here in the zippers, we've got all the gauze padding, and sterile bandages, along with the tourniquets. And then in these side pockets, we've got the triage pocket for tagging victims of a larger incident. And then in the vitals pocket, we've got all of our vitals monitoring equipment. Again, the bag's looking pretty lean right now, and the instructors have been made aware of that. So Clayton and I are working on restocking the bag. And if you've got any further questions or you want to look in here yourself, just let me know, and I'd be more than happy to pass it off to you to check out and figure out what's in here. So thanks, guys. See you in the morning.